More than 25 years after Legionnaire's disease was first identified, public health officials are still trying to get doctors and hospitals to pay closer attention to the disease and its source. Today, Legionnaire's disease is more likely to strike inside hospitals than any other area. An estimated 88,000 people per year die from hospital-acquired diseases such as Legionnaire's.
The people who are at really great risk are those who are immunocompromised because they've had an organ transplant or a lung transplant or cancer chemotherapy, or people who have severe underlying lung disease, what we call chronic obstructive pulmonary disease, who are smokers, and that type of thing.
Legionnaire is a serious respiratory infection, generally spreads through the inhalation of mist from contaminated water, a prime breeding ground for the bacteria, a hospital's own water system. Patients in a hospital can acquire the disease from using their sink or taking a shower. A lead proponent of testing water in hospitals is Dr. Glenn Morris of the University of Maryland. Dr. Morris says periodic sampling can help determine whether a hospital should take steps to fix its water system.
We have found that actually a fairly high percentage of hospital water systems may be infected with this organism.
Hospital-acquired Legionnaire's, which kills nearly 40% of its victims, is so underdiagnosed that in Maryland, health leaders have initiated guidelines for regular testing of hospital plumbing systems for Legionella bacteria. According to Dr. Morris, who helped create the Maryland guidelines, a hospital needs to assess its own risk level based on its patient population and the number of positive water tests for Legionella.
If a hospital indeed is finding the organism consistently in its water and has patients who are at high risk, then I think it's incumbent upon the hospital to put in place appropriate preventive measures.
The Maryland guidelines suggest hospitals that are getting a 20% positive rate on water tests to seriously consider the risk for an outbreak.
These are guidelines. They are not regulations. The hospitals are not required to follow these. But the other side of it is, if the hospital doesn't follow these guidelines, and if the hospital then runs into problems, if it has a patient who becomes infected, then the hospital is looking at potential major liability.
Researchers continue to debate the best way to prevent outbreaks in hospitals. Some say hospitals should routinely test their water supplies for the presence of Legionella bacterium, while the CDC prefers testing of patients already stricken with pneumonia.
The approach that CDC has traditionally taken is to say that we know Legionella is in the water system, but unless we can show that it's actually causing cases in the hospital, then don't do anything about it and don't look for it, because if you look for it, it's information you don't want to have.
But wherever one stands on the water testing debate, the fact remains nosocomial infections cost money and lives. Peter Steinmetz, an environmental investigator, knows the toll bacteria takes inside a hospital's water system.
It's estimated that the actual cost of nosocomial infections in hospitals runs about $4.5 billion a year, with only about 25% of that being reimbursed. So the hospitals are hit with a pretty heavy cost for nosocomial infections. The CMS, or the Center for Medicaid Medicare Services, is considering actually withholding payments if nosocomial infections, and specifically Legionella, are not held in check or efforts are not being made to reduce those. The insurance premiums is another issue. And the immediate effect of public relations from the Legionella or patients with Legionnaire's disease hitting the newspaper is, on a public relations standpoint, is a disaster. And all this is preventable. It's all preventable.
One method of prevention is a water decontamination system.
They're sort of, if you will, the short-term solutions that have been used in acute outbreak situations. This includes what we call, superchlorination, or using very high temperatures, jacking up the temperature in your water system so that you try to kill off all the Legionella that are present. Those solutions tend to be very short-term. They'll sort of clean things up for a week or two. But then the problems come back, particularly with the superheating. Now, with the high levels of chlorine, you can keep Legionella out. Legionella tends to be a little bit chlorine tolerant, so you've really got to sock it to it with chlorine to kill it off. But then you have to use so much chlorine, you tend to eat up your pipes.
But the decontamination process that may prove the most promising is a copper-silver ionization system specifically designed for hospitals. Unlike heat and flush or hyperchlorination, ionization continuously works against the buildup of bacteria. One company that manufactures these systems is Liquitech, an Illinois-based company with over 12 years in the business of controlling waterborne pathogenic bacteria. It was this system that the University of Maryland chose to install.
In this hospital, we have placed a disinfection system in that's called copper-silver ionization. And it basically works by taking copper and silver ions and placing them directly into the water. It creates an environment that the Legionella bacteria and other pathogens can't survive in. And it has the ability to penetrate the biofilm, which is a film that collects on the inside of the piping, and the ions do indeed penetrate that biofilm.
Penetrating the hard-to-kill bacteria of the biofilm is just one of the strengths of an ionization system.
With a system like that, it's possible to drop your Legionella counts down to zero, essentially to get to the point where you eliminate Legionella from your water system.
Another bonus, the copper-silver ionization process can be controlled from a centralized location for easy maintenance. As the manager of plant operations for Memorial Sloan Kettering Cancer Center, John Letson researched various water decontamination systems for the New York City-based hospital.
We just wanted to be sure that whatever system we chose was going to be the most reliable, certainly the most cost-effective. I think anyone really wants to do that. And something that wouldn't require a lot of maintenance and a lot of manpower from my department.
Installing an ionization system was part of Sloan Kettering's proactive approach to patient safety.
To date, it's been 100% effective, and we anticipate it to be effective way into the future. We've had no positive cultures since the system was turned on.
However, hospitals choose to safeguard their patients from nosocomial infections. The message is clear. A hospital's water system needs to be part of the plan.
Even if you prevent one case or two cases, those are one or two lives that are saved. And for me as a physician, that's important.
From Baltimore, Maryland, this is Karen Yiannopoulos reporting for i3 Medical.